All right. Hi, my name is Kenzie. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth? Great. Okay. So looking at the patient, I'm not seeing any signs of distress. The coloring looks within normal ranges for the patient's ethnicity. I'm not seeing any labored breathing or anything of that sort. So looking at their hygiene, looking normal grooming, hair looks washed. Nutritional status, I'm not seeing any signs of malnourishment. We're gonna go ahead. Can you tell me where you're at and what year it is?
I'm at Washington College, and it's 2023.
Okay, great. So pulling that curtain around. That was already done. And then we're gonna go ahead. The vital signs were already taken and recorded for by the CNA. So going ahead and looking at the head for shape and size. Just inspecting it. Can you tell me if you feel any pain? No pain. Okay. The head, I'm not seeing any signs of lice or any dandruff. And then can you go ahead and smile for me? Frown. Puff out your cheeks. Great. Okay. And then with that, I'm not seeing any signs of stroke or facial droops, so that looks good. With that, we're going to go ahead and move on to the eyes. So will you go ahead, actually just looking at the eyes right now, I'm not seeing any signs of edema. The eyes are bluish green color, no signs of makeup or swelling or any rashes around the eyes. So then we're going to go ahead and, will you go ahead and look at the object straight ahead for me? Okay, seeing the pupil dilate and retract. Alright, great. Pupils were retracting and everything looked normal. Okay, and then I'm gonna go ahead. So for that, there was normal perla, and then the ears. We're gonna go ahead and look at the ears and inspect the ears. I'm not seeing any signs of rashes or bumps. Ear looks good. Coloration looks normal, or within normal ranges. And then I'm gonna go ahead. No discharge or foreign bodies. So I'm gonna go ahead and palpate the ear. Tell me if you feel any pain or tenderness. Right here. Okay, great. Then I'm gonna go ahead and do the same thing to the other side. Okay, looking in this ear. Not seeing any signs of foreign objects. Coloration looks good. And I'm just gonna go ahead and palpate. Any pain back here? Any tenderness? Okay. Alright. Alright, now I'm just going to go ahead and do a whisper test. So can you go ahead and cover the other ear? I'm going to go ahead and just whisper something in this ear.
Perfect. And number 6?
Yep. Okay, and then same thing on this side.
Eyes were 330.
Okay.
That's where we're supposed to be.
So the hearing test was in normal ranges. No abnormalities were found there. So going on with the nose, we're going to go ahead and look at the potency. So can you go ahead and tip your head for me? Good. No deviated septum. No signs of... Are you having any drainage? No drainage. Okay, so then we're going to go ahead and... can you go ahead and cover one nostril for me and take a deep breath?
Yes.
Okay, great. Same thing on the other side. All right, great. So the breathing was good breathing. And then we're going to go ahead and look at the mouth and the lips. So just looking at the lip color, the lips are nice pink color, so the good oxygen levels. Can you go ahead and open up your mouth? Good signs. No signs of decay on the teeth. Mucus level, your mouth is nice and moist. No signs of dehydration. Okay, so then I'm gonna go ahead and use my tongue blade and just go ahead and will you look for uvula rise and fall? So can you go ahead and say ah? Great. Okay, so uvula went ahead and rise and fall. So that means that is without abnormalities. And then, all right, so looking at the neck, I'm going to go ahead and go over the cervical lymph nodes, looking for any sorts of tenderness or any pain. Feeling any pain or tenderness from this? Okay. Do the same thing on this side. Any pain? No? Good? Okay. So, no signs of pain with the neck. So, looking at the trachea, can you go ahead and lift your neck for me? Trachea is nice and midline. Any pain or discomfort?
Chest. Good.
Okay, and then palpate the carotid artery. Gonna go ahead and feel for your artery.
Contour.
That is at a 2+, nice firm pulse. Same thing on this side.
Colors.
I'm gonna have you take a deep breath.
2+ on that side as well. Okay, and then for this, we're gonna go ahead and inspect the retractions of. Okay. So looking at the chest. The color looks normal for ethnicity. The patient's hair distribution is pretty normal. Bennett might, I'm really sure. Okay, and then temperature. Okay, go ahead and palpate for muscle mass and temperature. Any pain or discomfort?
Okay.
Lots of deep breaths.
Any pain or discomfort over here?
I'm just gonna listen to your lungs here. Okay?
So no signs of crepitus. Everything looks good. So then I'm gonna go ahead and inspect the lungs. And looking at the retractions of the patient, both sides are rising levelly. Not seeing any signs of like collapsed lung.
Can you take a couple steps?
So, okay, will you go ahead and sit on the side of the bed for me?
Now I'm gonna have you.
All right, so we're gonna go ahead and just listen to your lungs, starting in the front. Could you go ahead and take a deep breath?
Jugular extension.
Okay.
So next time we're going to strength testing.
And then I'm going to.
Okay, do the same thing on the back side. Oh wait, actually, yeah. Okay.
Nice big deep breath. Okay. No adventitious lungs.
Yep, perfect. All right. So after auscultating the anterior and posterior sides of the lungs, it was consistent with normal findings. Did not hear any signs of labored breathing. And then, okay, so moving on to the heart. Palpate apical. So I'm gonna go ahead and looking for the apical pulse going down to midline, down 5 notches, about right there. Okay. And then I'm gonna go ahead and listen to it for 30 or 60 seconds.
I'm gonna listen to your stomach real quick.
So then I'm gonna go ahead and listen.
I'm really doing good today. No, okay. And then going ahead and moving on to the abdomen. I'm gonna go ahead. You want to go ahead and lay back down into the bed for me? We're gonna go ahead. I'm gonna go ahead and just palpate. Tell me if you have any pain or discomfort.
5 to 30 minutes.
And I'm still lifting up your shirt here. In case the color looks good. Okay.
All right, so no signs of pain or discomfort when I palpated the abdominal cavity. Now I'm gonna go ahead and listen for bowel sounds. I'm not seeing any signs of masses or lesions on the stomach. So we're just gonna go ahead and listen to each quadrant. Okay. Alright, so bowel sounds we're within normal ranges, no hypo or hyperactivity. So going ahead and moving on to this, I'm gonna go ahead and do some strength tests for you. So can you tell me, or can you go ahead and squeeze on my fingers as hard as you can? Okay, good job. And then will you go ahead and sit on the side of the bed? And then I'm gonna have you push down or push up on my hands. Good job. And then I'm gonna have you go ahead and wait, okay, how do I do this? Like push on my arms. Okay, yeah, push against me. Okay, now I'm gonna push into you and resist against me. Okay, good job. All right, so strength was standard without abnormalities. There was no unremarkable findings with the strength. It was normal for weight and age of the patient. So moving on. Oh yeah, okay. And then I'm gonna go ahead and have you just test your resistance. Can you go ahead and push against my hand? Push against my hand. All right, great job. So with that, there's no abnormal findings. Okay, and then I'm just gonna have you go ahead and do some walking tests for me. So can you go ahead and close your eyes and stand still? I'm just kidding. Whoa.
So use the provider. I want you to turn around. I don't want you to back up a little. I don't want you touching the bed. Get like a little bit further and go ahead and do it like
Oh, okay. So like, okay, for safety.
got like
A little cushion.
Can you push against my hands?
it's just a string.
You have a tail. Okay, I'm almost done. Okay. All right, so just giving you a little barrier. All right, that's good. All right, and then will you go ahead and take 3 steps forward for me, and then go ahead and turn around and do the same thing. All right, great. Now go ahead and get back into the bed. I hate the order. I should have done these in a better order. All right, now I'm just gonna go ahead and be feeling for your pulses and looking for your pulse flow and how strong it is. Okay. Okay.
Can you do me a favor?
Feeling for the peripheral pulse. There it is.
Okay, 3 steps back.
Oh yeah. That's at a 2+, not thready, and it is nice and bounding. Okay, and then feeling, yeah, wait. Okay, so feeling for the posterior tibial pulse. Okay.
Alright, make yourself comfortable in bed. I'm almost done.
Feel it on this side. Same thing yesterday. Yes, wasn't it?
Yeah, excellent.
Good.
11 minutes.
Oh, yeah. So it's like
I go that way too.
That was like,
wait, no, I feel it now on this side. I can feel it on this
yeah,
side.
so
Okay.
your first time.
And then the
this one was like right here. So let's look at how close it is.
I don't take shit like
right here.
She said to kind of feel around.
No, you did not. Oh, okay. You did not. Okay. Do you have a YouTube account or no? Okay.
Oh,
So
yeah.
let's get on like
Okay.
Can you get on? You have to get on YouTube. The app.
We are. Yes.
Okay. All right, and then going ahead and looking at the cap refill. 2 to 3 seconds is within normal ranges. Not seeing any abnormalities. Going ahead and doing the same thing on the fingertips.
Melina. I don't think they uploaded it too soon. Did everybody upload too soon? Instead of they would Zoom instead of YouTube.
All right, and everything looks great. Found no abnormalities.